Women's Health Wednesday now. We know heart disease is the #1 killer of women.
That's right. And ahead of American Heart Month, which begins next week, we take a look at the warning signs and how they may be different in women than men. Heart disease is the cause of about 1 in every 5 female deaths in the U.S. The most common type is coronary artery disease. It develops when the arteries in your heart become blocked by a fatty material called plaque, preventing your heart from getting the blood flow it needs. About 1 in 16 women over the age of 20 have it.
Heart disease can cause symptoms, but oftentimes, especially in women, there are not symptoms beforehand.
Cardiologist Dr. Jessica Saunders says the most common symptom is chest pain, heaviness, or pressure, especially during physical or emotional stress. But sometimes heart disease is silent and not diagnosed until emergencies like a heart attack, arrhythmia, or heart failure.
People will not recognize necessarily because they're used to thinking about it as a severe pain in the center of the chest. That is a common presentation, but it does sometimes happen in other locations.
Women are more likely than men to have less typical signs and symptoms of a heart attack.
Sometimes it can be a discomfort in the jaw or the neck, sometimes the shoulders or the arms, the upper abdomen. So it's often described as chest pain, but people feel it, especially women will often feel it in different ways than just the classic chest pain that you see on TV.
Sometimes the symptoms in women are totally unrelated to chest pain.
Women will feel fatigued, short of breath, nausea, sometimes lightheaded or dizzy. So any of those symptoms are something to be concerned about.
And it's important to recognize these signs of heart disease because time is of the essence.
Definitely don't delay. And if the symptoms don't seem to be subsiding within about five minutes or so, the safest and surest thing to do is to call 911 and get seen.
Good information there, just 5 minutes. That's
Exactly.
enough for you to say, wait a second, I better call the doctor and figure this out.
Mm-hmm.
Yeah. Best thing you can do for your heart overall is quit smoking, eat a heart-healthy diet, and of course, we know this one as well, but it bears repeating, stay physically active.
That's right. She says start even at 5 minutes a day and start working up to 30 if you can. Well, throughout the month of February, we'll be sharing ways to lower your chances of getting heart disease, so be sure to watch every Wednesday.